Hello, public health students. I just wanted to take a moment and pause and give you guys an update. We were planning to take a trip to Uganda this semester to go work with our partners on malaria and HIV and a bunch of other projects going on, and we are having to cancel our trip there due to a current Ebola outbreak. And right now, it's been hard to get data on the outbreak, and there's not a lot of communication. So, I wanted to just give an update here and also a call to action because there's a moment right now where you can step in and help. So, on January 29th, a 32-year-old male nurse died from Ebola. It wasn't confirmed until the next day when they got blood samples, and at that point, on the 30th, Uganda's Ministry of Health declared an outbreak in that country. They originally traced back to 46 contacts that this male nurse had. He had gone to 3 different health facilities to try to see why he was sick. And Ebola can feel like the flu, but then you start bleeding. It's a hemorrhagic disease, and then it starts to shut down your organs. It's a very messy disease, and it spreads through contact with bodily fluids. And so he had gone to 3 different health facilities, so at least 46 people came in contact with him. Then the most recent update was his wife was infected on February 2nd, and she's symptomatic as well. And now the count is up to 234 contacts. So people who've come in contact with either the wife or the husband, and those with symptoms. And so we're just monitoring this for right now. The US has not been deployed to help, and they're not sending assistance at this time. So the World Health has showed up. So, we're just praying that this gets contained quickly, but it is a very serious disease. This strain of Ebola does not have a vaccine yet. So it has a case fatality ranging from 40% to 70%. So that means between 4 and 7 people out of every 10 who get infected die. So it has a very high death rate. So that's why this is very serious and alarming and concerning. And so I'll post updates here so you guys can keep up to date with the most recent reports, since data is hard to find at the moment. But students, what I want to do is call you to action, because I've been in contact with our partners there just daily, because this is something scary to walk through. And again, there's not a lot of communication even for them. And I think the country is just trying to wrap their brains around another outbreak and how to contain it. And so our partners are asking for resources. So I'm calling an emergency public health student meeting on Saturday morning, and we are going to rally together. We are going to get information for them. We're going to get trainings together for them, and we are going to help resource our partners on the ground in Uganda so that they can go teach their communities. They can prepare them, they can prevent disease, and just bring peace in the middle of such a chaotic time. So early Saturday morning, we are going to meet for a public health meeting. Either message me or email me if you are interested in helping.